of Life Choice Wellness Center, and today is day one of a 21 days series that we're going to be going through live here on Facebook. So the first topic of today is going to be, what is functional food testing? Is it effective? And number three, who should be food tested? All right. So functional food testing is a test where we look at specific foods that don't elicit an immune reaction immediately when you first have the food, but in a delayed response. So in your immune system, you have cells, immune cells, that react immediately, let's say, to peanuts or shellfish or something to that nature. So you start to swell up, you start having a rash, your throat starts to close, and that shows that you have an immediate immune response, IgE response to this food, all right, versus a more delayed response, okay, that can actually occur up to even 3 days later, okay. So let's say you eat an avocado, right, and day one you don't feel many symptoms. Day two you start to have a little upset stomach, maybe a mild headache, then maybe you break out in a rash on day three. So that just shows that your body kind of had a delayed response instead of just that immediate spike. All right, so that's important because let's say you try to do an elimination diet, right, which is one of the ways you can test to see if you have a sensitivity or allergy to food. Sometimes you have to wait up to 3 or 6 months of not having that food in your diet at all whatsoever, along with other foods that may be triggers, in order for you to then reintroduce that food and see if you have an immune response. And again, you will have to wait at least 3 days, right, after introducing that back into your diet before you actually had that again, okay? So this is the type of test that we're doing. So it really cuts down that process to show you, okay, as a delayed response, when are you having these immune responses to which foods, and not just that immediate response, you know. So that's what the functional food test is, and it's a great screen for patients who are looking to find out which foods they should eliminate out of their diet, at least for a period of time, depending on how severe of an immune reaction they have to that food, whether they're trying to do a specific diet or are trying to improve a certain health condition, okay? So number two, is it effective, right? So again, some critics may say the only way to really find out if you're allergic to a certain food is to do elimination diet, right? So the food testing is a great screen, and it cuts down that time, and it is very effective as long as you use that same measure to retest after you eliminate it out of your diet, and you also correct some of the underlying functional things, whether that's the digestive tract that has a leaky gut or inflammation or whatever the case may be, that what else you have going on, okay? So this test can be very effective. I see it often with my patients who have tried everything, have tried several different diets, have been on several medications or even supplements, and haven't totally been able to correct the condition and really make that significant health improvement. This is a great way to do it. Okay, so who should be food tested? All right, so anyone who has trouble losing weight or weight loss resistance, right? So they can get the weight off, but they can't keep it off. These are the people that will need to have a food test in order to specifically say, okay, I'm on this diet, and although these foods may be allowed on this diet, does my body go well with these foods? Does my immune system react to these foods, right? Because inflammation is going to create challenges to losing weight, okay? Also, anyone who has an autoimmune condition, so rheumatoid arthritis, MS, or Crohn's disease or type 1 diabetes, any of these autoimmune conditions, lupus, you know, you want to see how your immune system is reacting to these foods. Doesn't it make sense, right? These are foods that we are eating on a daily basis. Although they may be quote unquote healthy, we need to see, is my immune system going well with the foods that I'm eating? All right, that just seems like it would make sense. Number 3, ADHD kids, right? There's lots of triggers in foods that can create inflammation, leaky gut, and then also affect the brain, throw off brain chemistry, and create lots of issues there. So ADHD kids, we see do great with a food test in order to really make that significant change. Also, people who have chronic migraines or headaches that are unexplainable, people who have digestive issues, right? Constipation, diarrhea, indigestion, all these things. These are great candidates for a food test. All right, so again, this food test that we do, it's in office, is very easy and simple. It takes less than 3 minutes. We do it with just a finger prick, so you don't even have to go in and get a full blood draw, which is great for kids, right? Great for adults as well who are opposed to needles. So this test can be also sent out to anyone, right, around the nation here. So if you're listening to this and you're on Facebook but you don't live in California, we can get you the information, get you tested, right? It'll be great in order to help the next piece of just getting you into a better health and overall correcting some of these immune responses you're having. So hope this helped. If it did, please like and share to anyone that you may think could be have a benefit to this. And I look forward to seeing you tomorrow. Again, we'll be here live 21 days straight. Let's talk health on various different topics. It's going to be fun. So this is Dr. Dawson signing out. And remember to choose well, live well, and be well.